No health without peace for Palestinians and Palestine refugees was the theme of this panel discussion on May 24th at the Intercontinental Geneva Hotel, Switzerland, co-organized by the UN Relief and Works Agency for Palestine Refugees in the Near East and the World Health Organization.
And just to underline what a Palestinian patient who needs referral services in East Jerusalem needs to undergo, we did this infographic just to underline that there is 9 steps that they need to undergo in terms of administrative requirements in order to obtain eventually a security permit from Israeli authorities.
The event took place on the sidelines of the 70th World Health Assembly. The panel presented the impact caused by conflicts, blockade and occupation on the health of Palestinians and Palestine refugees in camps.
The problem of Palestinian camps started really 69 years ago by the occupation of Palestine, and at that time one part of the Palestine started called Israel. And since that time many Palestinians are living in the camps with a very bad situation.
2017 is a sad year for Palestine refugees. It marks 50 years since the beginning of the Israeli occupation, 10 years since the blockade imposed on Gaza, and 7 years of the war in Syria.
At the same time, we have to speak also about the discriminating wall, that also the only wall in the world that divided or isolated more than 300,000 Palestinians.
Our world is facing 65.3 million forcibly displaced people, in addition to some 5 million Palestine refugees, and nearly 34,000 people are forcibly displaced every day.
Anyhow, regardless the health situation in Palestine, regardless or in spite of all these obstacles, in spite of all these problems, we succeeded to overcome many of these problems by having best indicators in the region. And this is thanks for our understanding, thanks for the international community, thanks for UN agencies, thanks also for the people supporting Palestine.
The UN Sustainable Development Goal number 3, to ensure healthy lives and promote well-being for all at all ages, seems not to apply to everyone. And then there is the UN goal number 16, the peace goal. Because in the absence of peace, as is the case in the Middle East, there will be no health. One cannot expect to eliminate health inequities and secure the basic human rights for the most vulnerable populations if one sits back and let injustice reign. The Holy See is on the forefront when it comes to support Palestine and the peace process. In January this year, the Palestinian embassy to the Holy See was inaugurated. A signal of the Pope's love for Palestine, said President Abbas. The two leaders spoke privately of the contribution of Catholics in Palestine and discussed their promotion of human dignity and assistance for those most in need, especially in the fields of education, health and aid.
I want to say that the Church in particular is supporting Palestinian. Caritas charity, they are supporting Palestinian. Many facilities were supported, health facilities, by the Church directly. And when we are speaking about social problems, when we are speaking about psychosocial problems, when we are speaking about handicaps and disability, these are supported directly by the Church in many places in Palestine, Gaza and West Bank. Thank you very much.
It remains to be seen if the targets for the health of Palestinians and Palestine refugees will be met. But it definitely depends on achieving the most important goal: peace.
I am committed to trying to achieve a peace agreement between the Israelis and the Palestinians, and I intend to do everything I can to help them achieve that goal.